Hello, my name is Kiana Vigil, and I am one of the Transact liaisons for the immunization program, the other liaison being Marissa Estrada. And this is going to be a refresher of some of the outreach vaccine billing protocols and guidelines for Transact. Please note this presentation is for the New Mexico Department of Health Public Health Office use only for those that are Transact users and enter for vaccine outreach events. Starting off with vaccine consent forms, also known as Part Bs, this chart covers all the do's and don'ts when filling out the vaccine consent forms. I'm going to cover those that are commonly missed or overlooked. They are the ones that are starred. So it'll be the legal name, race and ethnicity, insurance information, correct formulary names, lot numbers, expiration date, injection site, funding source, pre-populated forms, and most current consent forms. And I'll elaborate on these in more detail in the following slides. We also suggest printing this chart for future reference. So continuing in detail, legal name, common issues we see are misspelled first and last name, using a nickname, missing multiple last names, or illegible to read. So please make sure the patient's full legal name is clearly printed. Race and ethnicity, these are commonly missed fields, so please make sure these fields are completed as they are required in NMDOH. And if the patient does not want to share this information, please note it. Insurance company name, subscriber ID, and group number. Now, this section is often left blank or partially filled. Please clearly indicate if the patient is insured or uninsured, and if they are insured, make sure to provide the correct and necessary insurance information. Also, please make sure to check Medicaid eligibility for all patients. Vaccine correct formulary name, lot number, expiration date, and injection site. The common issues we see are blank fields, incorrect formulary name, wrong vaccine given to a patient, for example, giving a child an adult flu vaccine, using the vaccine sticker label. So please make sure all fields are completed and correct. This is because the biller or Transact user cannot determine these fields if they're not completed correctly by the vaccinator. Funding source. This is a commonly missed field, often left blank. The vaccinator must indicate which funding source the vaccine came from so that there's no confusion for those posting in Transact. A reminder that this field is very important in the process of generating revenue through Transact for our public health offices. So if this field is left blank, we cannot charge for the vaccine, even if it is an ASP vaccine, and that would be a loss on revenue. So you can see if this occurs often, the revenue loss could add up. Pre-populated forms, only the vaccine information and site designation should be pre-populated. The date can be pre-populated if it is a point of distribution. So below are examples of what accurate pre-populated consent forms should be. The top example is from a VFC consent form, and the bottom is from an adult consent form. As you can see, each field is pre-populated corresponding to each vaccine. And when being filled out, the vaccinator can just circle the information for each vaccine that was given. This is very helpful and efficient for both the vaccinator and biller because of how clearly everything is indicated. And these are examples of inaccurate pre-populated consent forms. As you can see, the vaccine sticker label was placed as a way to fill out the form. We advise not to do this because it is illegible to read when scanned. The correct vaccine formulary name is not always given, and it does not contain all the necessary information needed to fill out the form. So then this creates more time and effort on those billing and Transact. If you have any questions about creating pre-populated forms, please reach out. Also, please ensure you are using the most current consent forms. This is because NDCs, vaccine formularies, and fields are updated to maximize accuracy. And the forms must also reflect the current DOH logo branding. As a friendly reminder, current adult and VFC consent forms are always available in NMDOH under the reports module. Next, I will go over each vaccine funding source as a refresher. In case you're wondering who dictates which funding source, it should always be the vaccinator, and remember to always bill based on which vaccine funding source. Starting off with VFC, vaccines for children. This is the funding source for children under the age of 19 who cannot be charged for CDC recommended vaccines. Therefore, the billed product will always be zero. But Medicaid and Medicaid MCOs can be charged for the administration of each vaccine. To the right is a screenshot of how it looks when entering individual vaccines using the Transact platform. This is an example showing how a VFC funding source should be entered and how it should appear. As you can see, if the patient is a child under the age of 19, then the product funding selected will be VFC, and the billed product will auto-populate to zero. That is to ensure the child will not be charged for the vaccine. And for the billed admin, as stated in red on the side, it will always remain as $22.79. No editing is necessary. Next is the funding source 317 adult. It is used primarily for outreach events and points of dispensing for those underinsured or not insured. There is no charge for the actual vaccine, so when entering in Transact, you will manually zero out the billed product amount. Medicaid and MCOs can be charged $22.79 for the administration of each vaccine. So to the left is an example showing how a 317 adult-funded vaccine should be entered and appear. The product funding should be private, and like I stated, the billed product will need to be manually zeroed out. As you can see in the example, the billed product of $22.35 will be manually changed to zero and appear like it is in the green. And for the billed admin, as stated in red on the side, it will always remain as $22.79. No editing is necessary. So just as an indication, this is the only funding source that will need to be manipulated. The other two funding sources will not. Lastly is the funding source ASP, adult special purpose. For this funding source, adult vaccines and administration fees can be billed to contracted insurance companies. Entering in Transact, you will not need to edit any amounts, and Medicaid and MCOs can be charged for each adult vaccine and the administration of each vaccine. So to the left is an example showing how an ASP-funded vaccine should be entered and appear. The product funding should be private and the billed product will remain as is. This amount will not need to be changed for this funding source. And for the billed admin, as stated in red on the side, it will always remain as $22.79, so no editing is necessary. So overall, those entering in Transact just must be aware and know what funding source a vaccine came from for the correct billing, and the vaccine funding source should always be dictated by the vaccinator on the consent form. As we have received questions regarding billing for 317 and ASP-funded vaccines, we'd like to go over how they should be billed. So all billing of vaccines should follow which funding source it came from, regardless of the circumstances it is being used for. So always follow and bill based on which funding source the vaccine came from. So if the vaccine came from a VFC funding source, you'll bill it as VFC. If it came from an ASP funding source, you will bill it as ASP. And the funding source should be dictated by the vaccinator on the vaccine consent forms. And the funding sources are just to ensure that the patient is not responsible for the vaccine or the vaccine administration, and that all charges will have 100% program adjustment. So just a quick example, public health offices are out of 317 inventory for a vaccine. To circumvent the situation, the vaccine manager provides the PHOs with ASP vaccines. These ASP vaccines are used to administer to those patients who are 317 eligible. So how do you bill for these? So just ask yourself a couple questions. So which funding source did these vaccines come from? They came from ASP. And so how would you bill for this funding source? You would bill it as ASP. So just a quick explanation. So although the ASP vaccines are to be used for 317 eligible patients, no matter what, the vaccine is still coming from the funding source ASP. Therefore, it is required to be billed as ASP and not 317. So just takeaway, just to always pay attention to the funding source that a vaccine is coming from and bill according to that. We've also received questions regarding insurance plan coverage and adult vaccination. This table helps indicate whether to vaccinate or bill a patient based on their insurance plan, and I'll briefly explain how to navigate it. So where you would start is with the red question. Does the patient have, say the patient has a Medicaid plan. So does the patient have Medicaid? You would find um, the insurance plan name. So Medicaid, and then um, if it's yes, you may vaccinate. No, you may still vaccinate. Not sure, you can still vaccinate. And then the blue symbol next to the insurance plan's names um, are for the billing portion, and it lets you know if we are able to bill them or not. So the Medicaid insurance plan, the Medicaid turquoise care plans, you'll see it has the blue asterisk, and if you look at the key underneath the table, it tells you that NMDOH is contracted with these plans. Therefore, NMDOH can submit insurance claims, and it also lists out the insurance plans that NMDOH is contracted with. So this is a very helpful tool. Please feel free to print this out for your public health office's use. Now just a couple Transact reminders. Here is a chart of what should be entered in Transact and what should be entered in Bear. Any outreach event conducted offsite of the PX show should be entered using Transact. So like any outreach events for flu, outreach events at health fairs, back to school outreach events, all these outreach events should be entered using Transact. And therefore, any individual patient vaccines administered at the public health office must be entered in Bear. So for example, any adult or children vaccines at the public health office clinic, any public health office clinic visits, anything that's non-outreach, these should be entered using Bear. A friendly reminder, you should never enter in both programs. It will always be one or the other. This is because entering in both programs can cause errors such as duplicates and NMSIS and denial in payments. And lastly, no sharing of Transact user access. This is a HIPAA violation. Sharing login information creates inaccuracy and faults on the authorized user if any mistakes do occur. If you do need access to enter and Transact, please feel free to reach out to me or Marissa, and we can get you set up so you can receive the necessary training and guidance. And our point of contact information is at the bottom if needed. And as a friendly reminder, this presentation is for New Mexico Department of Health Public Health Office use only for those that are Transact users and enter for vaccine outreach events. Thank you.